Sleep apnea basically is of multiple kinds. That is basically, it can be obstructive sleep apnea, central sleep apnea, or mixed sleep apnea. Essentially, the most important one is obstructive sleep apnea. That means sleep is, we understand it is sleep, and apnea is cessation of breathing. It's a normal physiological phenomena as well, but when it occurs for more than 10 seconds in a duration and with a frequency of more than 5 events per hour, then it becomes pathological. And as the name suggests, that is obstructive sleep apnea. So it is due to the obstruction in the upper airways, which is labeled as obstructive sleep apnea. Well, obstructive sleep apnea can be caused by multiple conditions, and the most essential one is, of course, the development of the lower jaw of the person. That is, if you have a smaller jaw, receding chin, and kind of either you have in the mouth you have a larger tongue, what we call as macroglossia, or if there is a high palate, a heavy palate, basically anything which is contributing to the narrowing of the inside area, which will cause sleep apnea. So it could be obesity, could be an add-on factor, because lean and thin patients can also have severe sleep apnea depending upon the jaw position. If there's a smaller jaw or a receding chin, even a thin person can have. But obesity adds on to this particular condition. And there are certain aggravatory factors which are there. That is like, taking alcohol will increase it, taking sleeping pills will increase it. And this is something which will cause, enhanced amount of sleep apnea in a patient who is already predisposed to it because of his anatomical position. Well, the signs and symptoms are very common. If you start from night to day kind of a symptomatology, so first is, of course, the most cardinal symptom is snoring, and which is actually the sound generated by the vibration of the soft and the floppy parts of the tongue, palate, and the surrounding pharyngeal tissues due to air passing through a narrowed lumen. And apart from that, there could be, say, dryness of mouth, there could be drooling of saliva during sleep from the angles of the mouth, there could be increased amount of, acidity or reflux. There could be nocturia, that the patient has to get up for urination in the night once or twice extra. Even after a full quota of sleep, you do not rise up fresh in the morning. You feel groggy, and it takes for you a longer time to get to the near normal position. So apart from that, it could be an early onset of high blood pressure. It could be daytime sleepiness when you are not actively working, and in severe cases, even if you are actively working, you could sleep anywhere and everywhere, while sitting, while watching television, while reading a book, while being in a car, while operating machinery for that matter. You can just doze off or have a tendency to doze off. Apart from that, it is an early onset of diabetes, an early onset of hypertension, plus memory lapses, and the patient might also have irritability in the nature, forgetfulness. So those are the things that will be there, and they are generally things which are taken as something which are normal to life. So people do not take it as a disease. In fact, not only people, sometimes even doctors do not take it as a disease. And that is why, despite its very high prevalence, it is underdiagnosed and undertreated, or misdiagnosed and mistreated. Yeah, that's a very important question actually. The snoring is, anyways, as the definition I told you, that it has to be because of the narrowing of the air, when the narrowing of the airways. When the air passes through that zone, it causes vibration in the surrounding structures. But not necessarily all will be having sleep apnea. There are times when 5 to 10% is contributed by the nose itself. It could be severely deviated nasal septum. It could be increased turbinates, or the side wall thickenings of the nose, which could reduce the airway lumen. They can cause it. And occasionally, even the snoring in the throat is not complete apnea. But when the symptoms are arising along with this thing, like of daytime sleepiness, tiredness, exhaustion, and nighttime difficulty, and choking and gagging sensation, then it becomes a significant thing. So it has to be coupled with the symptoms. But anyhow, snoring is more or less never normal. So if it is there, whether it is an ENT problem or it is a problem of sleep apnea, it should be addressed. As I told you, obesity is one of the major risk factors. So if a person has got a smaller lower jaw, that is basically the prerequisites are there. Even an extra pound, every extra pound that a person gains for every extra kilo that a person gains, it increases his predisposition to have sleep apnea and may also affect its severity. Then people who consume alcohol, their muscles relax and they have much more stoppages of breath. And additionally, they could be longer because your mind, which is your wake-up organ to save you, it is also sleeping. So it could increase the severity as well as the duration of the apneic spells. Then a lot of people in India, in our country, especially at the drop of a hat, we are taking, sleeping pills like, Compose, like, Alprax, like Zolpidem, that is Zolfresh. And they are unfortunately very easily available. So what happens is that these patients, once they are snorers, it could really aggravate the condition very severely. And smoking, as usual, is something which will harm almost more the things. So inflammation caused in the upper area, that can also increase in this area. The first thing is, of course, once we take a detailed history, we do know that, okay, the patient is something who is likely to have sleep apnea. Now, the thing is, there are multiple ways that we can diagnose the condition, depending upon the type of clinic the patient has gone into. It could be a minimalistic, it could be a maximalistic. For a sleep expert, like as we deal it, we would like to see much more than what is already visible or already thinkable. In that case, we go for full polysomnography, at least for the first time. Subsequently, we can lower down the number of channels if we know that there is a lesser disease. So, because in sleep, in polysomnography, we study the total brain activity, the eye activity, the muscular activity, the heart activity, respiration, body position, leg movements, so as to have a comprehensive review of the total sleep, the number of the sleep efficiency, the breakages of sleep, if there are other reasons which are causing break in sleep apart from sleep apnea. At the lesser level, it could be less number of channels, around 8 to 10 channels, where we can see that nasal airflow is being monitored and the snoring levels are being monitored, the chest and expansion movements are being monitored. So we have different grades of machine systems, and it can be done in a specialized kind of a sleep laboratory, or it can also be done at the home of the patient, and for that matter, anywhere the patient is. Today we have got a whole range of equipment which can be portable as well as standalone. Now, before we treat the case, it's very important. Now, unfortunately, what happens is, like they say, things should be made simple but not simpler. The problem is that, equipment sometimes, the machines are, the data is only as good as the person who is reading it. Because if you are not interpreting it correctly, or if you are under-interpreting it, your treatment might not yield benefit. But any which way, if you have diagnosed sleep apnea, there are 2, 3 or 4 ways of doing it. Not necessarily in the order of preference. The thing is, one is the lifestyle changes that can be done. Like in a severely obese person, he should be encouraged to lose weight. In a person who is taking alcohol, he should be encouraged to minimize the utilization of alcohol. If he is taking unnecessary sleeping pills, thinking that this is a treatment for sleep apnea, we should avoid that. Apart from that, there were initial treatments of positioning the body, but that is something which is difficult because if you are so conscious of it, when will you sleep? Over and above this, then the most important tool, of course, is a machine what we call as CPAP. CPAP, that means continuous positive airway pressure system. And this system has got, this is a fixed pressure system as well as intelligent system. The intelligent system has got sensors which measures the flows of the airways. When it narrows down, it automatically raises the pressure to keep it open. It acts as a pneumatic splint, like it acts as a kind of a flow which will prevent the collapse of the upper airways. So there will be no stoppages of breath, and the patient will be able to breathe normal. There will be no fall of oxygen saturation. There will be no load on the heart, and the patient will rise up fresh in the morning and better in the morning. Again, having said that, we have other kind of machines which are also available, like BiPAP and BiPAP Auto. The thing is, we have to definitely choose our patients very carefully, because BiPAP is generally used for respiratory failure kind of conditions, whereas BiPAP Auto, which was made to be a kind of an automatic BiPAP, but it has got much more utilization as compared to what it was thought of as when they were bringing it. So severe kind of sleep apnea and very mild kind of sleep apnea, they respond much better to BiPAP Auto, because the difference of inspiration and expiration, it gives a huge amount of leeway and an ease of breathing to the patient during this period. So these are various kind of equipments that we use, and they are basically the gold standard for since 1980-81 onwards. But then there are surgical techniques which are there. People are using uvulopalato-pharyngoplasty, people are using laser-assisted uvuloplasty, people are using somnoplasty, that is through a radio frequency probe. We basically reduce the size of the palate and the tongue so that there is a volumetric increase inside. But having said that, these are still basically more for the treatment for snoring and not for sleep apnea. The thing is, it is being used, but the results are yet to be seen in a bigger way. And if there is a recurrence of that or not, because removing a substance may not always be very good. But at the same time, yes, so all in all, we need to choose our patients very carefully. If the patient is only having snoring, he has no other symptom, and he has no sleep apnea, then surgical tool can be used more confidently. Then there are dental devices. Basically, they are lower jaw forwarding devices, what we call as mandibular advancement splints or mandibular advancement devices. So here we basically tailor make a kind of a mold from upper and the lower jaw with the protrusion of the lower jaw to the maximum of 75% of its total protrusion that can be done. And that basically we use as a nocturnal splint where the patient is having it in mouth so that his lower jaw is kept forward. As a result to increase, but again this has got its own pitfalls. Like, if the patient is not chosen correctly, the thing is the TM joint inflammations can be there and they take longer to heal. So it is a treatment for mild condition. And again, when we do a nasal endoscopy or other thing, if the opening is vertically narrow, then these should not be used because that will cause total collapse despite the thing. So all in all, we have options. We can work together. A dental person and sleep specialist can work together. An ENT person and a sleep specialist can work together. A lifestyle changer kind of a thing can work with the sleep. The thing is basically, essentially the goal is how to make the patient feel better. So that is the goal. But yes, the gold standard still remains CPAP. But we have ancillary kind of other treatments in the form of surgery. Yes, an important thing, a child who is suffering from sleep apnea, the treatment of choice still today is the surgery, that is adenotonsillectomy, in case tonsils and adenoids are enlarged and they are compromising the airway sufficiently. Because normally they are known to disappear, the adenoids, by the age of 11, 12, 13. But if the closure is much more, if the oxygen is fallen, then we can do it early surgery to relieve that, because it is important for the children to have a proper kind of a growth hormone secretion which occurs in the deeper phases of the sleep. And if we are not helping that, then the stunted growth could be the result of it. So that is where surgery will have a major stay in pediatric cases. Well, actually today if you look at the research that has happened in the last 30 years, virtually no system of the body is safe, be it cardiology, because it is one of the biggest causes for, say, essential hypertension. In fact, JNC 2003 had labeled it as #1 cause, and it still stands today. Then cardiac failure, sudden cardiac arrest during sleep. Then the patients with, the thing is, basically it is something which can cause a lot of cardiological morbidity and mortality. And this can be treated 100%, so it could be well taken as a preventive medication in a lot of cases. The second is, of course, that a larger number of strokes, they would occur because of this, because of the hemodynamic instability during sleep apnea. There is a sudden sharp rises of blood pressure with every snoring and snorting cycles. And as a result, it can cause basically stroke due to hemorrhage, as well as the rise of the blood pressure. And it can also cause the embolic stroke, that is because of the vibration of the, vibrations basically having shearing effect on the atheromatous plaques, so which can rupture and cause embolic stroke. So that is another feature. Then diabetes is basically can be severely aggravated by sleep apnea. Diabetes can be, got a good kind of today we have a larger number of support from the research that is showing that it increases the insulin sensitivity, this insulin resistance. And apart from that, obesity itself can be caused by sleep apnea. Not only sleep apnea is basically caused by obesity. Like in patients who have sleep apnea, there is fall in the levels of the hormone leptin and increase in the hormone level of ghrelin, which is a hunger hormone. So the thing is, another important thing that is there, that is the diabetes mellitus, which is the world's almost biggest killer today, and India is the world capital of diabetes. So it has been seen in last say around 20 years of research that sleep apnea does affect the severity onset of diabetes mellitus, and it is also seen to increase the insulin resistance. So the thing is, a lot of studies are today say finding it positive association between the two. A lot is to be proved, but I think the treatment of sleep apnea helps diabetes in many ways. And in fact, coming out of it, the new kid in the block is basically the end-stage renal disease, that is chronic kidney failure. Now here what is happening is that it has been in fact a recommendation from the American Kidney Society today that patients who have sleep apnea should be followed up for renal functions. There's a bigger chance that these people might develop it faster than others. And if it is so, then the treatment of sleep apnea possibly can defer or deter the development of chronic kidney disease. And the same would be true, the thing is the other way around, that people who have chronic kidney disease, they should be studied for sleep apnea so that at least to say lower down the future progress. If it is not totally preventable, but at least it can be lowered down. Now so far with the diseases, there are a lot of other things in the social circuit which is important for sleep. Of course, one is the you can say the nuisance value to the partner. But apart from that, the thing is, because of sleep deprivation, it is one of the largest causes for roadside and industrial accidents. 1/3 of all roadside and industrial accidents occur because of this. And this leads to a huge amount of damage. It could be life, it could be lifelong debility. And apart from that, there are many other things, issues, the economics, everything is being touched into that zone. And treating this thing could have prevented a huge number of accidents, could have prevented a larger number of deaths on the road. Because a lot of people do not understand that they have a poor kind of, say, an appreciation of their, say, wakefulness, and very poor understanding of their sleepiness. So as a result, they feel that they are in control, but what is important is a person can go from wide awake to deep sleep in less than 10 seconds. So you've got a thin margin of safety. So in fact, in the Western world, in America especially, the National Transport Safety Board, it has a recommendation for every big vehicular driver, for that matter, the persons who are running the ships, the person who are running the aircraft, they have to undergo periodic sleep study to see whether they are fit to take these people, because it is not only their life at stake, it is the stake of, there's a huge number of other lives and the material at stake as well. So it's important that this should not be basically, trivialized, and also not given into the hands where they cannot fully justify the need of the thing. So they should be done in a proper manner, in proper sleep clinics, so that they get the best out of the total sleep study. So this is so far whatever is there as far as sleep apnea is concerned. Well, sleep hygiene, there are actually more than 90 sleep disorders. So the thing is, it's a huge subject and can be, we can have a separate kind of a segment on that. But importance is that sleep hygiene for people who are not able to sleep, or they perceive that they are not sleeping, then there are certain points that we normally give them apart from medication after diagnosing. That one is that the irregularity of sleep and wake cycle should be avoided. Second is the person should go to bed only when you are feeling sleepy. Don't go in the bed to sleep, because bed is not a sleeping pill. And if you are just tossing and turning, you will have a negative feedback cycle, then you will not be able to sleep. Second is, whatever the time of your sleep, try and get up at a common time so that the sleep cycles do not shift in your, as a kind of a thing that it goes into a later phase area. Then thirdly is basically, you should basically switch off all the kind of mobile phones and everything at night, because the small tinkles that you have at subconscious plane, they are breakers of the sleep, and the bright light when you open is again basically detrimental to sleep. Then you should switch off your television at least half an hour before going to sleep, because if there is an interesting program, even if you are feeling sleepy, you tend to take it to conclusion of the program, and by that time you lose your sleep, and the next cycle comes after 1 or 1.5 hours, so it becomes very bad. You should also remove a wall clock or a clock which you have in your room, so that you don't keep on looking at the wall all the time. Apart from that, consumption of tea, coffee, alcohol should have at least 4 hours difference between the sleeping time and the consumption time. They should not have a lot of exercises before, in the later part of the evening, because it causes a lot of tiredness in the muscles, and a lot of people feel that tiredness induces good sleep, which is wrong. For sleeping you need a relaxed body. So in fact, one should avoid very tiring activity in the evening hours, and apart from that, a warm shower in the night is always helpful.